Down, Esmeralda.
Yeah, we're going to count down now. Are you ready, Larry? Larry's set to go. And Sandra, you can also start the webinar for the public.
Okay.
5, 4, 3, 2, 1.
Good evening, and thank you for joining us. Tonight's forum will be a discussion on the COVID-19 vaccine as we wrap up the 6th week in which COVID-19 vaccines have been made allocated for citizens in McLennan County. It is no surprise that attention has turned to the benefits of the COVID-19 vaccine. Joining us tonight will be panel remarks from former United States Congressman Chet Edwards. With 20 years of national government policy experience, Mr. Edwards will share a national perspective on the delivery of the vaccine. Dr. Jimmy D. Hunter, pastor, Tolliver Chapel Missionary Baptist Church, with over 35 years of service in the ministry, he will share the perspective of the vaccine as a prominent member of the faith community. Councilwoman Andrea Barefield, newly re-elected representative for the City of Waco City Council District 1, she will share where we are in response to the vaccine from the perspective of cities. And Dr. Peaches Henry, president of our Waco NAACP since 2015. After remarks, we will move into our conversation period with Dr. Terry A. Woods Campbell. Although Dr. Campbell is not an infectious disease specialist, her area of specialization as an obstetrician gynecologist places her in a position to treat and counsel a class of patient that the Centers for Disease Control and Prevention have categorized as a vulnerable population, pregnant women. It is from that lens that she will share insight into vaccines and more specifically, the COVID-19 vaccine. At this time, we will begin our COVID-19 vaccine discussion with our panel remarks, beginning with former Congressman Chet Edwards.
Well, good evening. Commissioner Miller, let me first thank you for your work in fighting COVID. Tragically, yesterday, 7 of our neighbors in McLennan County died of COVID-19. Our hearts and prayers go out to those families, and now you and I have to ask ourselves, how can we protect our neighbors and loved ones? For me, it means wearing a mask, social distancing, and cleaning my hands on a regular basis. It also means taking a life-saving vaccine that has a 0 chance of giving us COVID, but a 95% chance of protecting us. I'm not a doctor, but President Biden, Vice President Harris, and former President Obama have access to the best doctors in the world. And if they felt the vaccine was safe enough for them to take, then it's safe enough for me and my family. Regarding vaccine shots at the Waco Convention Center last week, out of 1,500 shots given, the Waco Tribune-Herald reported that 330 went to people living in Woodway and only 5 to people living in East Waco. If those numbers are anywhere close to being true, that is simply not fair, especially given when one takes a COVID vaccine can be the difference between life and death. No one intended to make the vaccine process unfair. We need to understand this is a complex, challenging, once-in-a-century pandemic, and McLennan County and Waco can't control the supplies coming from Washington or even from our state government. But now that we know the McLennan County results from week 1 at the convention center, I do think the process must be changed away from an internet-based last-minute sign-up process that did not fairly serve our low-income, minority, elderly, and disabled neighbors. The new plan I've heard today is going to use an existing waiting list of about 14,000 people, and that might be a significant improvement. But if that waiting list process was not effectively communicated to all of our citizens, then it could lock in until April an unfair distribution of COVID shots. Let's all work together in good faith. And I'm confident, particularly with the kind of leaders that we have on this program tonight, who've been working for months to protect McLennan County citizens from COVID. I'm confident we can build a vaccine program that saves lives and is fair to everyone. Thank you.
Certainly, I believe I was next. Certainly, thank Congressman Chet for those remarks, and thank you, Commissioner Miller, for the invitation to chair tonight in this seminar, because certainly this is an area that is quite a concern that we're having. Certainly, as pastor of Calvary Chapel and representing the leadership of our clergy in our city, we too feel the need to share. Calvary Chapel came into this process. We were probably one of the first churches who hosted testing sites. And so because we hosted testing sites, that let us know just how imperative and how important it is for our church community to be involved. Certainly as pastors, many times the church has been the foundation of the community and still is. And I think our congregants still look to pastoral leadership in so many of the areas that plague our community. Such is the case with Covid-19, and it's kind of been. I was gratified yesterday when President Biden and Vice President Harris led the country in that moment of recognition of some 400,000 persons that have died as a result of this, and McLennan County statistics is in the number. And I think that it behooves us to do what we need to do by way of the testing. I'm glad former Congressman Edwards brought out the statistics about the disparity between the numbers of persons in our community and the low number in East Waco. And I'm wondering if a lot of that has to do with persons not having available to them the information on how to get it like they need to get it. When we look at the, I think 1 in 9 of African American persons dying who are 60 and older, how many of them have access to Facebook? How many of them have access to Wi-Fi? How many of them, a lot of them I've had fun with some of them still have a flip phone. So, they can't really get all of the information that they would like to get. So it becomes word of mouth. And another problem that I'm seeing within some of the older persons, there's a fear factor that has come in here. And it's a lot of misnomer, a lot of erroneous information that's going out relative to the shot, what it'll do to them. Is it going to change this, change that? I think those kinds of things have to be dispelled. And I'm glad Dr. Campbell is on, because hopefully I think she can kind of bring some clarity to the fear that some persons are having relative to the shot. After I got mine, I was sharing with a member, it's okay. I said I've not had side effects from the vaccine, and she said, well, Pastor, I'm gonna just wait to see if you grow wings so I can know so I can know whether or not, I mean, she was being jovial, kind of being jovial for the moment, but I think that once the fear is dispelled and once and I'm glad to see more and more persons are desirous of taking the vaccine, because it certainly is going to be crucial to our community. And I'm glad and I'm hopeful that our church communities will begin to articulate that. I think the virus has affected us in a number of ways by way of how we are able to engage with our congregations. But I'm thankful that Tyler, we're using the phone tree to let them get the information. We're going on Facebook to let them get the information, and just kind of talking to as many persons as we can. So I certainly encourage other pastors in our community to do all you can to encourage persons within your congregations to be able to feel comfortable, and pastors kind of need to lead out and go get that first shot.
Thank you, Pastor Hunter. And I am here tonight, ladies and gentlemen, to talk a bit about our suspicions and the fear factor that we have. The National NAACP has been following developments with the COVID vaccine from the very beginning. They have been hosting virtual town halls with people who are involved in that research. And so I want to talk to you just a few minutes about those. So I first want to bring to your attention these two names, Dr. Patricia Harris. She is the immediate past president of the American Medical Association, and she is an African-American doctor. I also want to bring to your attention Dr. Marcella Nunez Smith. She is also an African-American doctor who has recently joined the Biden administration. I bring those two names to you because they are part of the NAACP family. And they spoke to us in an all units meeting in December to let us know a couple of things about COVID research. So the first thing that Dr. Marcella Nunez Smith explained to us is that though it has been less than a year that the vaccine has developed, the work that has been going on around that vaccine has been going on for years. So though it seems that this happened really quickly, she wanted us to understand that the mechanisms and the foundational research that has been going on around the vaccine, it is not new. It did not just get developed in the last 9 months. So that I know many of us are thinking about how quickly it seemed to have been developed. So she was explaining that to us. The other thing that she said to us is that she wants us all to understand that our fears and suspicions about the American medical community and its attitude toward African Americans and people of color is well deserved. And that is that, yes, we have suspicions and we have fears of them because of our past history with them. And as we know, that history is not as past as people would like to give the appearance. And so she said to us that our fears and suspicions are valid, that they are not our fault, that it is a result of how we have been treated by the Medical Association. But then she said she wanted to assure us of this, that we are now in a period when we have people such as herself and Dr. Harris and Dr. Woods Campbell who are working in these areas. And she says that it is their business to make sure that we are no longer mistreated, that we have people from our community who are working in these labs, who are working in these hospitals, and that it is their mission to make sure that we are not mistreated. And therefore, we do not have to be afraid of vaccination. Now, we can make our own decisions about whether to take them, but she wanted to assure us that we don't have to be afraid, that the science that is backing these vaccines is solid science, and that she literally has had a hand in developing these vaccines. And so that is also, you should know that the NAACP is watching. We are keeping our eye on what is going on. And we are now in an administration that is placing equity, fairness, and safety at the forefront, so that we are in a place now where we can trust that we are going to be protected. And so I am engaging in meetings on a regular basis with a national organization, which is engaging with the scientific community at the highest levels, as well as with the present administration. And it is their business to make sure that we are safe and that we will be able to trust vaccines. So as my mom used to say, what's your mama's name? And then she would tell me, you listen to me. And I'm not going to say what's your mama's name, but what I am going to say is that the NAACP loves you and cares about you and is going to make sure that you are safe. So we are being vigilant as we watch this process. Thank you.
Good evening, everybody. Thank you again, Commissioner Miller, for convening this amazing group of people to share their wealth of knowledge and speak from their hearts, from their industry, from their perspective about how we move forward getting our people vaccinated. This is no easy process, and we've been walking this since, from what we know, January of last year. And our health district and the partners that we have been, we're doing everything we can to, number one, inform folks of what's going on. And we are grateful for our community leaders like Dr. Hunter and other faith leaders who stood up and said, we're going to do our part, because that's how we're going to get through this. This vaccination is but the second part in getting past COVID-19 or dealing and getting with it. I've spoken with several of my fellow council members from all over the country, and this is not a problem. This inequity is not a problem that's just in McLennan County, that's just in the city of Waco. We are dealing with this around the world. This morning, I was watching the news and they are talking about vaccine vacations, and that's people from other countries coming into the United States to sign up on vaccine lists. So it is something that we're trying our very best to deal with. I am so grateful for the staff that we have at the McLennan County Health District and all of the people involved in standing up what has been now our 2 vaccine clinics. The fast and furious facts are we don't have a lot of vaccines. The way our rollout is happening from a federal level to a state level, then to our county level, is like trying to pour the ocean through a spigot. And it's unfair and it's tough. And it's something that we're trying our very best to do the best way we can for our people. Because at the end of the day, we're the people at the table, the people in office, the people at city council, commissioner's court are fighting for you. We're fighting for the numbers. We are the health district. I've spoken with them, the city, and I'm sure Commissioner Miller has spoken with them from a county perspective. We're ready to stand up. And so as soon as we get our numbers, we are prepared to open the doors and do what we have to do to get as many people vaccinated as possible. Our numbers are daunting right now, especially looking at the breakdown of our racial demographics. But I know this. I know the people on this call, I know the people who you elected are committed to seeing that everybody who wants a vaccine will get one. Now, I understand your frustration. Everybody doesn't have internet. We know this. And so we're trying to mount the phone calls, get as many staff people as possible. I believe this past weekend, the rollout that we had, they were fielding 71 calls per minute. 71 calls per minute. And if you know anything about a phone, that's hard to do. But we're hiring more people. Last night or Tuesday night at council, we entered a resolution with MCC to allow students to become more vaccinators. So as we get more vaccines, you have more people who are able and trained to get vaccines in arms. Now, the one thing I will say, and I want you to know that everything that we get as a health district is getting out. So we're calling people if we have cancellations. And what we try different ways, because we are literally building this plane as we fly it, to get as many people vaccinated as possible. But I want you to know that this process is going to go through, and the more now that we've had a shift in leadership and a shift in transition and a focus to really roll out and do everything we can from a national perspective, working with the states to get as many vaccines into McLennan County as possible. McLennan County is one of 28 hubs in the state of Texas that is designed to get vaccines out, but we're not the only ones. We're working with our hospital leaders for more transparency about how they're issuing out their vaccines. And the answers are unclear right now, but we are dedicated to making sure that everything that we do ends in more people, more of our community, more communities that are disenfranchised, more communities that don't have the access that everyone does gets the vaccines as we get them. Now, what we can do as a community is reach one, teach one. We've been doing this a long time. And as you know, if you have neighbors who are older, help them, call for them. get them on the list. And that way, as we get vaccines, we can just start making those calls and rolling those calls out so that everyone who wants to get a vaccine can get a vaccine. We know we're dealing with, Dr. Henry mentioned, trust issues. And so I'm so glad to hear from Dr. Woods Campbell, because she is a beacon of truth and facts. And following her on social media is hearing it as clear from the horse as you can, because she is one of the reasons that I gained more trust in this process, because it's someone I knew or someone that I was familiar with, that I had seen in the community leading by example. And that's what we intend to do for you tonight, is to lead by example. But know that we hear your frustrations, and know that we are with you and dedicated to making sure, all of us, that we take care of one another, because this is a beast unlike any we've seen. But we know that if we line up and link arms and do it together, we will win. And we will continue to do the things that keep us safe. As the congressman said, we wear our mask, we wash our hands, we keep our physical distance, because we're not done yet. But the only way we can know for sure that we move past is to continue to do it together. Thank you.
Thank you, Council Member, and to former Congressman Edwards, to Dr. Henry, and to Dr. Hunter. I would like to thank all of our panel remarks. At this time, I'd like to remind you all there is a Q&A section. And so if you are out there in YouTube land, I ask now that if you have questions for our panel members, that you would go ahead and put those in the Q&A. And so again, at this time, I would like to introduce Dr. Terry A. Woods Campbell. She is a 2001 graduate of the University of Kentucky College of Medicine. Again, she is a practicing OBGYN doctor here in our McLennan County community. Her practice is located in the Women's Health Center on the Baylor Scott and White Hillcrest Medical Center campus. Good evening, Dr. Campbell.
Good evening.
We'll get just straight to the questions, because I want to give you all the time that you need to answer, because I know that what you're going to say is going to be a wealth of benefit for our listeners.
Absolutely.
Our first question: in attempting to understand the purpose of vaccines in general, could you share with us how will the COVID-19 vaccine work for someone who receives the injection?
So this is a good start, because I think some of the misconception that people have is because they kind of have not really understood how vaccine or this vaccine works. So let's talk a little bit about old vaccines. So old vaccines, like when you were a baby, you got the tetanus shot, the MMR, the measles, all of those. Those vaccines were typically where they got the virus, they killed the virus in some method of form, and then they injected you with that killed virus, and your body responded to that virus or that killed virus, and you made antibodies to it. You created immunity. This new vaccine is totally different in that what they did is they took DNA from this vaccine, or mRNA actually specifically. This vaccine has that mRNA in it, and it's injected into you, us, the host, and our body then creates proteins that are kind of the component of the COVID vaccine or the COVID virus, and then your body responds to that, and that's how you create immunity. It's kind of a two-step, but it's better because you're responding specifically to the COVID-19 virus. And that's important because how your body responds is how well you are protected. And we'll get to that in another, I think, a later question. There are other type of vaccines. I know everybody kind of thinks about vaccines in general, but this one is really special in that it's giving you the DNA from the virus, and your body creates proteins of that virus, and then your body responds immunity to that protein that your body creates. So there's no, and a lot of people have said, oh, they're giving me DNA, so can it change my genetics? No, it cannot.
Okay, okay. As a segue into that, um, many people will be prone to want the virus because, from what you're saying, it is safe. It is safe. So, as I mentioned earlier, we are wrapping up the 6th week in which approximately 14,000 McLennan County residents have received at least the first dose of the COVID-19 vaccine. However, as Dr. Henry alluded to earlier, as she pointed out and noted, many of our citizens continue to have concerns and anxiety as it relates to the vaccine. So, from a medical perspective, could you address where does this possible mistrust may come from, and could you speak in addition to what Dr. Henry has so ably offered us, but could you also add to the ideas explaining the fear and the misinformation as it relates to the vaccine?
Mhm. Absolutely. So the fear that the African American community has is warranted, very warranted. I mean, if you think about the Tuskegee experiment, if you think about the situation with Henrietta Lacks, even the forced sterilization of Native Americans back in the 70s, it was a family planning process that they instilled, and they essentially sterilized 25% of Native Americans. So it is very warranted. However, I kind of think of it in the sense that as more African Americans have become a part of the medical community, obviously that's not something that they could continue to do. The cool thing is the actual one of the viruses, or one of the vaccines, I'm sorry, the Moderna vaccine, one of the people who helped produce it was a Black physician or a Black doctor, Dr. Corbett. Was one of the primary people who was responsible for the Moderna vaccine. So as more African Americans have become involved in medicine, have become involved in research, have become involved in even the government aspect, obviously some of those things it's illegal to do, obviously, but it's warranted that we would have fear. It's very warranted, and I understand that there's some this whole process has been politicized also, which has added to that fear and mistrust. The fact that this was rolled out in a lightning speed, they called it, was it warp speed? I think they called it. The fact that was rolled out so quickly, so we were all like, oh no, we want our bread to be completely done, So I understand, but the one thing I will say and emphasize, just like Dr. Henry had stated, that there were no steps that were skipped. The thing about a process of creating a vaccine, it is a very long process, primarily because there are steps that you take. You don't leapfrog one step over the other. And a lot of times there's space in between the steps. So you complete one part of the research aspect, you then submit your information to then move on to the next. And there's a time gap. So it can take sometimes years. What they did in this process, because, and I wanted to stress that, and I did in my Facebook post, that there were no steps skipped. What they did was they moved along as if they were not going to have any problem. So once they started step one, they applied for the step two process. So there was a lot of overlap, really. And so that's why it was warp speed. But I think the interesting thing moving forward, there will not be these long clinical trials, because if you can get this vaccine that's life-saving out in 9 months, then you can crank out a medicine or a vaccine in the future in a much shorter period of time as well. But that time frame, the politicization of the vaccine, that contributed a lot to the mistrust and the fear out there in the community. And again, very warranted. But again, we need to think about the fact that, just like Dr. Henry said, those two African-American physicians that are involved in this process, the one research PhD physician or doctor that was involved in the creation of the Moderna vaccine. So at this point, we need to kind of think about it as a leap of faith and trusting that those of us that are out here, we got you. We got your back. We are not going to, our goal is to uplift and help and have our community grow and flourish, as opposed to how inordinately how this virus has really come through our community like a bulldozer. So that's not anyone's goal. And I hope they can trust us in that regard.
Well, I thank you for that answer. I really do. And I feel that not our patients, but I feel like our listeners, our community citizens, they will have trust hearing it from such reliable sources. And so probably another question that they will ask is just how effective will this vaccine be for me? Some people may become more comfortable with the idea of the vaccine if it is explained within the environment of its protection against contracting COVID-19. So could you for us explain what is the vaccine's protection rate? How effective will this vaccine protect me?
So I'm glad we had this discussion. And when we chatted one-on-one, I was glad that you brought it up, because I think the layperson thinks about how well will this vaccine protect me? And they think about the percentage that's been thrown out there. So the Moderna vaccine is 94.5% effective, and the Pfizer is 95% effective. So they're saying, and they're trying to, superimpose, oh, that means that it's a 95% protection rate or a 94.5% protection rate. And that's just not the case. Those two terms are not interchangeable. And so I want to throw out two other terms: efficacy and effectiveness. So when you think about how a vaccine works, or even let's just talk about drugs in general. If you have diabetes, if you have high blood pressure, when you take a drug for those you take a medication for those disease processes, the way that medicine works is its efficacy. So there's not a protection rate in the sense. So how well it controls your high blood pressure, how well it controls your diabetes, but the efficacy is always going to be compared to people who aren't on the medication. So it's always two populations that you're talking about. You're talking about people who are on it and people who aren't on it. So the efficacy is how well it works and treats the people who are on it. So the vaccine similarly. In the patients who got the vaccine in that clinical trial, that warp speed clinical trial, 95% of those who got the vaccine were protected, in a sense, from severe illness versus those who didn't, if that makes any sense. So efficacy is how well it works in the population that uses it versus those who don't. Now, effectiveness is how well it works out in the world. Now, let me tell you what can impact effectiveness: the number of people who get the vaccine. So let me just say that again. The effectiveness of this vaccine is going to be impacted by the number of people who get it. So if not a lot of people get it, we can't really say how effective it is, because it's not really been tested out in the world. It's just been tested in those clinical trials, those groups of people that they used it in versus the people who didn't get treated. And so I say all that to say protective percentage, I kind of don't want to use that. I think we should move away from that term because that is deceiving. I think that we should move towards efficacy. Again, the vaccine, how if efficacious it is. And again, the Pfizer is 95% efficacious and the Moderna is 94.5% efficacious in reducing severe disease. So I really want to harp on that. And again, effectiveness is impacted by the number of people in the world, i.e. the community, that get the vaccine. So if not a lot of people get it, it's going to be very difficult to kind of test its effectiveness. And one thing I also want to mention is that a vaccine's effectiveness or efficacy is so a vaccine can be really efficacious. It can protect those that get the vaccine and those that don't get the vaccine. But it does that because if enough of us get the vaccine, we can then thereby almost be protective of those who don't. And that's part of its efficacy. So vaccines and, just drugs in general are how well it works in the people who get it versus the people who don't. And then its effectiveness is how well it works out in the world, out in the community. And that's impacted by the number of people who get it.
Okay, that's very interesting. And I think what gives us a sense of calm and gives us a sense of trust with the vaccine is the percentage that you mentioned. One is at 94% and the other's at 95%. And I believe they said that was really great considering that vaccines are normally in the 70 percentile.
Yes. Yeah, and if you think about it, if you compare it to, say, like the flu vaccine, which changes every year because the flu vaccine or the flu, influenza A and B, they mutate so frequently. And this might be a question in the future. I'm not sure if I'm jumping ahead.
No, you go ahead.
But the flu vaccine's efficacy every year changes because it's always based on how well it's going to work against the flu viruses that are out there. And we can't always predict what's going to be out there because it mutates every year. So you might have one year, which I remember one year I got the flu after getting the flu vaccine because that year it was only 30% it only had a 30% effectiveness because there was so many strains and so many mutations to the strains that were out there that they just couldn't create a vaccine to cover them all. So it was only 30%. You had a 1 in 3 chance that you were going to be protected, and then a 2/3 opportunity to get the flu, which is what happened to me. So with the COVID, we don't know that information. So we don't know how much it's going to mutate. We do know of one more mutated strain that's out there, that UK version that has now crossed over the seas and the waters and is now here wreaking havoc. And we don't quite know, there's not really much known about whether or not this vaccine is going to protect against that strain. Are they similar? Because again, that came after those vaccines were already out on the market. They'd already been cleared for emergency use by the FDA. So there's still a lot that we don't know about usage in the future and time frame, immunity, those kind of things. But I think we're going to get to that question here in a minute. Sorry if I jumped ahead.
No. You did fine. In fact, you touched on what a lot of people have a little anxiety about, and that is, we talked about COVID-19. In fact, in 2 days, I believe we'll hit the national anniversary. They said January 23rd of last year is when we had our first case. So we're coming up on a annual anniversary. And a lot of people, when they heard that the multiple strains of COVID, it made me nervous. But when you put it in the context of the fact that even the flu has multiple strains, so we shouldn't, or should we, have anxiety that the COVID virus is mutating? Is that something that coronaviruses do?
That is something that coronaviruses do. But because of the way that this vaccine was created, being that they took the DNA or mRNA from the virus, it is literally that DNA part is probably very similar across strains. And that's what makes this vaccine so unique. And I think that's probably what makes it work so well, because it is literally taking DNA from this virus, and you, again, like I said before, it's injected into your body. Your body creates proteins, and then your immune system reacts to those proteins, as opposed to, in the previous vaccines where they just give you a dead version of it and your body reacts to it and you create antibodies to it. That's how the flu vaccine is kind of made. It's like they put a bunch of strains in there, and they give it to people and you create antibodies to it. So this is completely different in the sense of it's it should work across strains. But again, because this was rolled out in the way that it has, we haven't really had the opportunity to look at how well it's going to work. Although we do know, and I was reading this a few days ago, that the flu vaccine or the COVID vaccine that's out now does have an effect of having you don't have as severe disease if you do get COVID with it, even if you get that other strain. It's just your disease process is not as severe.
The more you talk, Dr. Campbell, the calmer I get about COVID-19. And that is the whole purpose of this town hall. Those are the last of the questions that I wanted to bring to the community. I have some other questions that were emailed in to get your thoughts on. For someone who has received the injection, many questions have been asked due to the fact that the vaccine and the coronavirus that causes COVID-19 are so new to us, like you said, in general. So some of the questions that came in, the first one was, are people safe from COVID-19 immediately after receiving their first injection? If not, when does the immunity begin and how long will it last?
So the short answer, no. So the way that this vaccine works, this series, and I want to stress series vaccine, because I think people think, oh, I'm going to get this first shot and I'm good. I can snatch my mask off. I can go hug my family. No. That 95% efficacy for the Pfizer vaccine is after the second shot. And actually it's 7 days after the second shot. And I would probably hazard a guess to say even 7 to 14 days. So you don't have that 95% efficacy of use until 1 week to 2 weeks after your second shot. That is the recommendation. There is some immunity that is kind of beginning after your first shot, but it's only 52%, I believe, 50 to 52%, which means you got a 50-50 chance of still getting it even after you've gotten your first shot. Do you want to take that? Do you want to take that kind of risk? I would say no. So again, short answer, no, you're not immediately immune. Everything takes time.
Right.
And this is one of those. Now, the difference between the Pfizer and the Moderna is that the space between the first and second shot for Pfizer is 3 weeks. The space between the first and second shot for the Moderna is 4 weeks. So, and you need to adhere to that, or at least be in that window, because that is important. And the one thing I also want to kind of mention is that, people are fearful about side effects and things like that. They have a system where once you sign up, you can go online, or you can even go into your phone and you can register, and you then they will call you, they will text you, they will say, ask you, are you having symptoms? How are you feeling today? Did you have to take off work? I mean, it is very in-depth, the follow-up that they're giving. And I've since gotten my second shot, and they've called me again, or they texted me and say, hey, did you get your second shot? Because they knew I was within my window. So that is another second layer of kind of concern that they're trying to, and I think that would make people feel a little bit more at ease, because they really is a good follow-up. And some people, like Pastor Hunter said, have still got flip phones, but they'll call you too. All they need is your phone number, and they will call you at home. They will call your cell phone. They'll call your auntie, your grandma. They'll call whomever number you give them to ask and follow up to make sure that you're not having symptoms or you're not having a severe reaction. So that's just kind of another layer of I think, security that people should have, that it's safe.
That's wonderful. That's wonderful. The next question is, will this injection be an annual shot similar to the flu vaccine? I think you did touch on that.
That one we don't know, because I want to stress that this is an emergency use. The FDA issued an emergency use order for this vaccine. It has not, So it hasn't gone through all of those trials. So we don't quite know whether your immunity is going to be months or years. We won't really know that. And so that's going to kind of be borne out over time. I again, because it's a different type of virus or different type of vaccine, in that, we're using DNA from the virus. The thought is that it will be a longer immunity, but they just don't know. And just really quickly, I want to stress that, there's some that say, well, I got COVID, so I have immunity. That's not necessarily the truth. And there aren't really, research has kind of shown that people who have the disease or get COVID, their immunity initially might be robust, but it might not be prolonged. And they know, in this sense with these vaccines, they know what the immunity is because of the research behind it. So if you compare, because I think some people have said, oh, I had COVID, so I'm good, I don't need the vaccine. No, I think you should still get the vaccine. You just might be one of the latter persons in the line to get it.
Okay, well, I think along with being a brilliant doctor, you must be psychic, because that was the next question. And so I hope the listener was listening. It was, can I take the injection if I have recovered from COVID-19 infection? And your recommendation is that they do,
Yes.
Okay. So after that, the next one is, can I take the injection if I have an active infection, or if I reside with someone with a current infection and I am currently under quarantine?
So technically, yes. But I believe the recommendation is if you're not having severe symptoms. So if you're not having severe symptoms, then yes. But I do believe that there is a time frame. I want to say it might be 60 days. So again, you're going to be kind of the last of the line. If you're under quarantine with someone who has COVID and you've tested negative, by all means, you can get the COVID, you can get the vaccine, because that was my situation. I had my husband had COVID. Hope he's not watching, but he put it on Facebook, so it's out there. And I tested negative, and I ended up getting the vaccine within 2 days of getting back to Waco. So yes, you can quarantine as long as you've tested negative. You can get the vaccine. But if you're having severe symptoms, the recommendation is to wait.
Well, as a side note, I'd like to say that I am glad that you and the mister are healthy and okay now. We were praying for you all. So I tell you what, the next question is, you have answered that. No, I'm gonna let you do it again though in detail. You hit on it, but someone has put it in the Q&A, so we need to come back to it. And then I have a question for Dr. Hunter that was in the Q&A, and then Dr. Campbell, I'm gonna come back to you. Dr. Campbell, this is yours. Will the injection give me COVID-19?
No. So short and simple, no. Again, there was a concern initially that it's genes, and is it going to change my genetics? No, it is not doing that. It is essentially exposing you to the DNA of a virus. Your body creates proteins to that virus, and then your immune system responds to those proteins, and that's where your immunity comes from. So no, you can't get COVID from it. Sometimes the symptoms, and just really quickly, the symptoms from the vaccine can be similar to the disease, but no, you don't have it. It is definitely a milder version. You're going to have, you might have some soreness from the injection spot. You may have, sometimes there's a lot of allergic reactions, and that's kind of been out in the news lately. So yeah, it's just like when you get your flu shot. You got a sore arm, you might have a little bit of a fever, you might have body ache, but it is your body responding like it's supposed to a foreign thing. And it does not mean that you have that infection though. So no.
All righty. I'm going to come back to you, Dr. Campbell, for your wrap-up question. Dr. Hunter, in the Q&A, it says, I know your church has been a constant voice in getting the word out about testing and where to get the vaccine. Do you think other churches will soon get involved as your church?
I'm hopeful, because it's affecting our church. It's affecting our churches. Our churches are unable to come together. I mean, when you look at the fact that bars are open, when you look at the fact that gyms are open, when you look at the fact that all of these other places are open, but yet the church cannot come together. I mean, we spent a number of Sundays where we had drive-in worship. I mean, and it was a wonderful experience. I mean, we've not allowed the pandemic to keep us from providing the ministry that we need to provide to our people. I think it has caused the church to move into areas that many churches had not done, by virtual worships and doing whatever we need to do. So I think that relative to the church, I'm hopeful that more pastors will be more aggressive in seeking to encourage memberships to do and to take the vaccine and take the information that Dr. Campbell has given tonight, because it certainly has been an eye-opener, even as I've listened to her tonight, that it's really, I mean, it doesn't save us from, but it helps us in, if I can put it like that. It may not save us from the virus, but certainly it will help us should we contract the virus, and we don't have to worry about dying from it as we would if we did not. And I think that the start of that is having the pastors themselves take the shots and be able to say, as a leader of our congregation, I have taken the vaccine, and I'm, look at me, I'm still doing well. And I think that was the crucial point when we saw the presidents and leaders, stepping out first, getting it done, because it does put you at ease. I think relative to the churches, I think if pastors would make those steps, those who fall into those groups, they call me the senior pastor of the city, so I fall in that group. So I was able to do that. So I can't lead out and say I've done it.
Well, I can say, and not only because I'm a member of Tolliver Chapel, but if I were not, it would still be true. And that is that you're an excellent example of what our churches should do here in our community. So we thank you, Pastor Hunter. Dr. Campbell?
Yes.
We come to a close. Could you share with us why, as a physician, a member of the medical community, an African American, and a woman, why did you trust to take the COVID-19 vaccine, and what parting words do you have for us?
So I had never had any doubt about taking the vaccine. As rapidly as this thing has swept through this country and killed so many people, at all extremes of age, but primarily in our community, it hit the Black and brown community like a wrecking ball. I had no doubt to take it. I knew as a physician, and especially as an African American physician and female as well, that it was incumbent upon me to take a leadership role in that. Because one, people who see me do it are going to be able to say, well, if she could do it, then I could at least think a little bit harder about getting it. So I did it for that reason. And then I actually posted on Facebook because I hadn't really thought about doing that. I just was going to get the shot and, go on. But there was a gentleman that I ran across in the cafeteria at Hillcrest who asked me, pulled me to the side and said, Dr. Woods, are you going to get that shot? He's like, I just don't know. And, he's an older gentleman, and I didn't ask him his medical history, but I anticipate that he probably has some comorbid conditions. But he asked me my honest opinion about it. Now, I was literally walking to get some chips and walking back. So if he could take, if my opinion of this vaccine mattered that much to him, I could just imagine how much it mattered to my church family, my colleagues, my family. So that's really, he's really why I put it on Facebook, because there were so many things that I was hearing. And he said, like Pastor Hunter, you know, they asked you if you were going to grow some wings. He said, well, I just want to see if your toes fall off. So if you lose a few toes, then I'm just going to wait. And that's unfortunately our people's reaction. They want to wait and see what happens to other people. You know, they want to see it, you know, they want to see if there's going to be a bad reaction, because we, again, don't trust. So I wanted to do it because, again, I wanted to be a leader in that regard. I wanted people to trust and believe that it was safe. And that gentleman in the cafeteria is why I put it on Facebook, because I felt like if he could ask me, that there's so many other people that just had questions. And, you know, I've had some instant messages on Facebook about, hey, I have a question. Some of my friends, like, I got my shot, I'm having this symptom. Am I okay? Is my arm going to fall off? Those kind of things. And it's just a source for people in our community and outside for them to ask questions and kind of believe that it's safe. And that's important to me.
Well, thank you. And I hope that everyone tuning in enjoyed your discussion with us as much as I did. I want to thank you for being the example that you are, and our community is truly lucky, truly blessed to have you here. In fact, the individuals that I am looking at on this Zoom call, all of you, we are extremely blessed to have the caliber of talent and dedicated service. I have a former congressman, I always say he's my congressman, who has not stopped dedicating himself to the service of our community when he could have just, rolled up his sleeping bag and went home to his comfortable life. He still stands on the front lines with us, arm in arm. And for that, Congressman Edwards, I will be forever grateful and indebted to you. Pastor Hunter,
Thank you,
Dr. Henry, our council lady, our lady down at the city, council lady Edria Bearfield, all of you. We are so blessed to have you, and thank you all for giving us your time tonight, because all of these individuals had other functions and were pulled from other events, but they made time from 7 to 8. And we're not going to hold you out there in YouTube land any much longer. I just have a few thank yous to give out, and that is to Councilman Hector Sabito and Nally Colensi. They chair the Strategic Communications Group that made this town hall logistically possible. To Sandra Camilo, Esmeralda Hudson, to Mayor Meek, to Council Member Bearfield, and to the City of Waco family. Thank you all for always being the backbone of logistically getting out these communications to our community. Again, to our panelists and to you, our audience, thank you for.
Commissioner?
Yes, sir.
Could I take a little legislative license and ask one question?
Oh, I'm not going to stop you from talking. Yes, sir.
No, I know. If listeners listen to Dr. Woods Campbell persuasive arguments about why the vaccine is safe and how it can save their lives, but they're listening right now and they want to know how to sign up in McLennan County for a COVID vaccine, how would they do that?
At this time, the wait list is open, but there's a short window, but they can go to covidwaco.com and sign up for the City of Waco wait list with the Public Health District. They can also go to Department of State Health Services, and there is a local providers map that will give them all of the local providers here in McLennan County that are receiving allocations of the vaccine, and they can call those providers and sign up for their wait list. We have a lot of people who are willing to take the vaccine, and I'm glad that the information is getting out into these communities, especially our vulnerable communities, and that is their reaction to it, that they want the vaccine, but we've got to try to get the vaccine into McLennan County.
Commissioner, there's also a phone number for those who don't have access to the internet and locally, which is 254-750-1890. We understand that there have been some issues with the phone line, but we are setting up a recording, which will also give the information that one needs. The hours of that is 8 to 5 during the workday. So if you're calling outside of that, there will be a recording which will give you some information. And once you sign up for the wait list, you are on the wait list until you either roll through and get the vaccine in which you're taken off.
Okay.
And the community should understand that the health district is also working to get vaccination days that are on the weekends as well. for people
Yes.
who are working during the day. So they are working very hard to make them accessible for you to get the shot.
Yes. And
Thank
as we have more vaccines, and we will set up more clinics.
Okay. And you all out in YouTube land, you can see how knowledgeable this panel is. So you can Google them on Facebook. You can Google them on the internet to get a connection with them to further. If there's information, you need more details. Like I said, covidwaco.com, Department of State Health Services, that number that the council lady gave us, 750-1890, but also this wealth of information of those wonderful faces that you're looking at. And again, thank you for giving us this hour. I truly hope that you found it as beneficial as I did. Thank you, Dr. Terry. Thank you, all of you.